As doctors, we frequently come across patients who come to us and show us reports that show vitamin D levels which are very low. And they ask us, do we need treatment and what should we do? So, vitamin D deficiency is a very common disorder that we see in people of all ages in the north and south of the India. And vitamin D deficiency is because we do not get adequate amount of vitamin D in our food and also from sunlight. So it is a problem that is commonly encountered in most of the people. But not all patients who have vitamin D deficiency are symptomatic. Vitamin D deficiency is seen particularly in certain people like elderly people and those who stay at home, who are homebound, and people who have a little bit darker skin, and those who have liver and kidney disease, gastrointestinal disorders, and those who are obese. Apart from that, it can be seen in any individual because our exposure to sunlight is quite low. Most of the time we stay indoors. So should we treat these patients who have vitamin D deficiency? In many cases, patients do not have any symptoms, but if we encounter vitamin D deficiency, we do advise them treatment. But there are patients who are having not only vitamin D deficiency in their blood reports, but they also have symptoms related to vitamin D deficiency. So what are these symptoms that are seen in patients with vitamin D deficiency? As I said, in most patients, no symptoms. In some patients, there are symptoms like muscle aches, muscle pains, tiredness, early fatigability, difficulty in climbing stairs, difficulty in getting up from the chairs. Patients can also have certain mood changes. Vitamin D deficiency can also increase your risk of developing fractures. So vitamin D is very much important for keeping your bones healthy. It is also important to keep your immunity status in a good state. Now, how do we manage patients who are having vitamin D deficiency? Number one is to see if we can provide vitamin D in their food. There are certain food items that contain vitamin D. Not commonly eaten food items are having vitamin D, but there are certain food items which you should be aware do have some amount of vitamin D in them. They are certain fishes like salmon fish, mackerel fish, tuna fish, and certain mushrooms, and then egg yolk also does contain a bit of vitamin D. And in case you can increase your exposure to sunlight, that also helps to increase the vitamin D levels. But apart from that, if you have significant vitamin D deficiency, then your doctor might advise you vitamin D supplementation in the form of medicines. In most cases, patients are given oral vitamin D supplementation, but in patients who have severe vitamin D deficiency and who are very symptomatic, doctors may even advise injectable vitamin D supplementation. So it is important that you check your vitamin D levels and consult your doctor for appropriate treatment.